Good morning, everyone, and as you heard, my name's Sarah Wiley, and I have the absolute pleasure of being the fundraising and events manager here at Motor Neurone Disease WA in Perth. Now, I do hope you're enjoying the beautiful weather in our city. Look, I moved to Australia 10 years ago from the UK, and going home reminds me why I moved here. Now, I have no doubt that you're all looking forward to lunch, so I promise to try and make this presentation as engaging as possible. But I'd like to talk to you today about measuring outcomes in the not-for-profit sector, and more specifically at Motor Neurone Disease WA. I should also preface this talk by explaining that we are a very small organisation, one of the smallest in the room. We currently support about 180 people living with motor neurone disease in Western Australia, and this would be about 95% of all people living with MND in the state. So our numbers are very small. We only have 10 staff and a very limited budget, and as such, we don't have all the answers. Some of what I say might be very obvious to some of you, and you'll be leagues ahead of us. But my aim is to leave you with some food for thought, and at very least a pleasant segue into lunch. And of course, if you have any ideas for us, please don't hesitate to find me at lunch. I'll be the one looking very grateful in the corner because my presentation is done and dusted. Since 2015, the Centre for Social Impact at the University of Western Australia have been evaluating how not-for-profit organisations are measuring outcomes. In their most recent study of April this year, they reported that outcomes measurement practice has decreased between 2018 and 19. Despite this decrease, the level of effort directed towards outcomes measurement increased or stayed the same for the vast majority of organisations. The biggest barrier to measuring outcomes is a lack of funding for such measurement. Over the past year at Motor Neurone Disease WA, we have introduced new fundraising initiatives and ideas. We have established and provided new educational workshops to the wider, more rural community, and we have increased staffing. But what does this equate to? Donors and investors want evidence that they are making a difference. We need to provide more clarity on the objectives, the paths to success, and the measures of success. We need clear performance measures so we can accurately determine if we have succeeded or failed. But what is outcomes measurement? According to the US-based not-for-profit accounting firm Smith & Howard, outcome or performance measurement is essentially a method of determining the impact of a program or activity. Unlike traditional measures, such as the number of clients served or the amount of donations received, outcome measures allow an organisation to assess whether a program is achieving its intended results. An outcome is generally described as a specific desirable result or quality of a non-profit services. In this presentation, I'll address the following 4 questions. What outcomes do we currently measure at Motor Neurone Disease WA? And what tools are we using to do this? Are we truly measuring, or what are we truly measuring? Are we just measuring reporting activity, or are we measuring the real impact of what we do? Are we really reporting outcomes in the most effective way we can to our clients, volunteers, and to the general public? And how can we present our outcomes in an interesting and user-friendly way? So firstly, what outcomes do we currently measure at Motor Neurone Disease WA, and what tools are we using to do this? We have 4 major areas we currently measure. So first being the Client and Carer Satisfaction Survey. This survey is sent to all clients and carers in Western Australia and is based around the reporting requirements of the Department of Health. It measures the quality and the impact of our services, including access to information, support services, equipment, and timely referrals. It is the only true measurement we have of the impact that our organisation has on the quality of life of someone living with motor neurone disease, aside thank you cards and verbal thank yous. This survey is sent via mail and email once a year, and a report is produced from the results. A summary is included in our newsletter. A person can request the report, and the author of this survey, Professor Samar Uan, the president of Motor Neurone Disease WA, who's here today, has the findings published internationally. The results are used to identify areas for improvements, such as access to services for regional people living with motor neurone disease. And this has led to a plan to employ a regional MND advisor and was a leading factor in the establishment of our regional education programme. Then we have our MND advisor service provision. MND advisors in Western Australia support and coordinate care for someone living with motor neurone disease and their family carers from diagnosis to death. They do this through emotional support and practical guidance. MND advisors are the primary advocate for the person with MND in Western Australia. MND advisors have key performance indicators such as initial referral to initial contact and time frame for the first home visit. These are recorded in an online database and performance is measured against these KPIs, which in turn ensures patients receive the service that they require according to set standards, aligning with our mission of delivering preeminent specialist support to enhance the quality of life of people living with MND in WA. Our MND education workshops. Earlier this year, we introduced a series of MND education workshops aiming to address the gap in services for people living in regional Western Australia compared to those in the metro area. As an aside, Western Australia is Australia's largest state and covers an area of 2.5 million square kilometres or 1 million square miles. So we might not look after many people, but we certainly have the complexity of distance. Currently, these workshops are targeted at healthcare professionals who work with people with MND or have an interest in this area of care. Professionals in the relevant field cover topics from assisted technologies to respiratory care to psychosocial support. As these workshops are very new to my association, the post-event evaluations are imperative to ensure that the content is delivered at the correct level. Feedback has suggested further education is required in the areas of speech pathology, occupational therapy, physiotherapy, and dietetics, and as such we'll be including these areas in 2020 and beyond. And in the future, we also plan to take our full services to people living with MND in the regions through regional face-to-face roadshows and online. And then we have pre- and post-event feedback. Although currently our method of gathering feedback for events is very rudimentary, the use of social media and word of mouth leads to a two-way conversation and means we plan and execute our events around our actual supporters, not just what we think would work. So, what are we truly measuring? Are we just measuring reporting activity, or are we measuring the real impact of what we do? So to understand this, it's important to understand what impact is. In this case, definitely not this. But at Motor Neurone Disease WA, our impact is how our services directly improve the quality of life of someone living with motor neurone disease. In some areas, we do this really well, such as the Client and Carer Satisfaction Survey, which measures the real impact on quality of life. But it's not clear how our other areas of measurement demonstrate impact. We know events fund our services, and we are improving year on year. We know our education workshops inform healthcare professionals, and we receive excellent feedback from what they have learned. But it's hard to quantify and qualify the real impact, and as such, we need a simple way to demonstrate how this money and knowledge helps to improve the quality of life for people living with motor neurone disease. So are we really reporting outcomes in the most effective way we can to our stakeholders? We currently report our outcomes in a number of ways. Newsletters, annual reports, social media, health department reporting, word of mouth, carrier pigeon. Or maybe not a carrier pigeon, but how do we reach that person that isn't on social media and lives in whoop whoop? That's a great Aussie term for the middle of nowhere. And doesn't have access to a regular postal service. How do we communicate our impact to them? And how can we present our outcomes in an interesting and user-friendly way? Communicating impact is not just good practice, it is also an excellent opportunity to engage donors and potential donors in our work. Clear, verifiable, and effective communications around impact can be very persuasive in bringing home a charity's purpose and values to supporters. A tool increasingly being used by not-for-profits is impact reporting. Impact reporting is a communication strategy used to convey the change created by an organisation or activity and how that change was created. Crucially, it needs to be compelling. Communicating impact isn't just about sharing numbers, it's about bringing those numbers to life. In our case, it might include statistics such as the number of nights spent out of hospital and at home with family, or how many communication aids were funded by our donors. And are we maybe missing an opportunity with the meteoric rise of smartphone ownership? In 2019, 91% of Australians own a smartphone. Now, the biggest barrier to measuring outcomes is the lack of funding for such measurement. But if money wasn't an issue, could we report our impact in real time? The Australian Blood Service sends a personalised text message to you when your blood is being used, when your blood has an impact. Imagine if we could send a text message to our donors, sponsors, supporters, volunteers. Sarah, today your donation paid for Drew to receive an NIV machine, allowing him to breathe easier. Or maybe, Sarah, because of you, June and her family are attending counselling today following her recent diagnosis. Could we? I'll leave you with these final words from Andrew Cairns, banking sector CEO. Measuring outcomes isn't just about accountability. It can make not-for-profit organisations more effective and maximise impact. And please indulge me by allowing me to read some words which I believe beautifully articulate the impact that my small charity has on the lives of people living with motor neurone disease in Western Australia. June was the first person I met with MND. Despite her diagnosis, June attended many events with her family and friends. June passed away in August this year, just over 2 years since her diagnosis. 6 months before her death, June wrote the following words. She was no longer able to speak or use her hands, so she used the Tobii eye gaze machine that we had provided her with. These words were read at her funeral by her loving husband, Rob. Value the everyday things in life, the things you take for granted, like walking, running, jumping, skipping, and dancing. Appreciate the ability to hug your loved ones, to hold a knife and fork, to feed yourself, to wipe your bottom, to hold a pen, to turn a page. Take pride in the mundane, getting out of bed, brushing your teeth, doing your hair, going to work, mowing the lawn, hanging out the washing. Holiday with family and friends, go camping, caravanning, or cruising. Make memories to share. Revel in your children and your grandchildren. Teach them all you know. Share traditions, nursery rhymes, fairy tales. Read to them at every opportunity, the classics, the humorous, the nonsensical, the latest. Play games, take them to the park and to the movies. Praise their achievements, encourage their creativity, and cuddle them often. Rejoice in being able to speak clearly, to express an opinion, to voice your love, to sing. For 70 years, I could do all of these things. Motor neurone disease took away these abilities and left me with a profound sense of disempowerment, sorrow, and loss. But with the support of Motor Neurone Disease WA, I was able to live my life with MND with dignity, supported by the association in every way my family and I needed. Thank you very much for your time today, and I'm open to questions.